Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The UCLA Loneliness Scale assesses subjective feelings of social isolation and perceived loneliness. It measures the degree to which individuals experience dissatisfaction with their social relationships. The scale evaluates emotional and social dimensions of loneliness, including feelings of emptiness, rejection, and lack of companionship. Its main purpose is to identify individuals at risk for adverse health outcomes linked to chronic loneliness, such as depression, cardiovascular disease, and impaired immune function. The instrument is widely used in clinical and research settings to quantify loneliness severity and monitor changes over time. The UCLA Loneliness Scale is indicated for adult patients experiencing subjective feelings of social isolation or perceived social disconnection. It is particularly useful in populations at risk for mental health disorders such as depression and anxiety, including older adults, patients with chronic illnesses, and individuals undergoing significant life transitions. Clinically, the scale aids in the assessment of loneliness within psychiatric, geriatric, and primary care settings. Its application supports the identification of individuals who may benefit from targeted psychosocial interventions and guides monitoring of treatment outcomes related to social functioning. The UCLA Loneliness Scale consists of 20 items designed to assess subjective feelings of loneliness and social isolation. Each item is a statement reflecting the respondent's social and emotional experiences. Respondents indicate the frequency with which they experience each statement using a 4-point Likert scale. The response options are never, rarely, sometimes, and often. Items are balanced with both positively and negatively worded statements to reduce response bias. Scoring involves assigning numerical values from 1 to 4 for each response, with higher scores indicating greater loneliness. Reverse scoring is applied to positively worded items before summing all item scores to obtain a total loneliness score. The total score ranges from 20 to 80. Scores between 20 and 32 typically represent low loneliness levels. Scores from 33 to 49 suggest moderate loneliness. Scores of 50 and above indicate high loneliness. Clinicians should interpret results considering the individual's demographic and psychological context. The scale provides a quantifiable measure to monitor changes over time or in response to interventions. The sensitivity of the UCLA Loneliness Scale reflects its ability to correctly identify individuals who experience loneliness, while specificity indicates its capacity to accurately recognize those who do not feel lonely. Studies have reported sensitivity values ranging from 75% to 85%, suggesting the scale effectively detects most individuals with significant loneliness. Specificity values have generally ranged from 70% to 80%, implying a moderate rate of correctly classifying non-lonely individuals. For example, in a clinical setting, a sensitivity of 80% means that 80 out of 100 truly lonely patients will be identified by the scale, minimizing false negatives. A specificity of 75% indicates that 75 out of 100 patients without loneliness will be correctly classified, reducing false positives. These metrics support the scale's use as a reliable screening tool for loneliness in diverse populations. The UCLA Loneliness Scale was developed in the late 1970s by Daniel Russell and colleagues as a tool to quantitatively assess subjective feelings of loneliness and social isolation. Since its initial development, the scale has undergone several revisions to improve its psychometric properties, with the third version published in the mid-1990s being the most widely used. Validation studies have demonstrated strong internal consistency, with Cronbach's alpha coefficients typically exceeding 0.9, indicating high reliability. Convergent validity has been established through significant correlations with related constructs such as social support and depression measures, while divergent validity is supported by lower correlations with variables unrelated to loneliness. Test-retest reliability studies report stability coefficients ranging from 0.7 to 0.8 over periods from 4 weeks to several months. Cross-cultural validations have further confirmed the scale's applicability across diverse populations, including different age groups and ethnic backgrounds. Factor analyses consistently reveal a unidimensional structure that captures the core experience of loneliness, though some studies suggest potential subdimensions. Collectively, these empirical findings underpin the UCLA Loneliness Scale as a rigorously validated instrument suitable for both research and clinical assessment of loneliness. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.